All right, so we are live. Just making sure there's like one more thing that it's doing. I just want to make sure it like goes and beautiful. Okay, so we should be good. Yes, we are. This is amazing. All right, so hello, and this is Thursday night. I want to say it's Thursday Night Live, like Saturday Night Live. Like I should be like Jimmy Kimmel or something. Tonight we are chatting the wellness approach to trying to conceive. This is the last event in the series for the National Infertility Awareness Week. And what better opportunity than to kind of, chat with some amazing local peeps and hear more about how their practices within their scopes benefit people who are trying to conceive, whether it's naturally or even if they're on the ART, assisted reproductive technology route. Very, very excited for tonight because these are people that I refer my clients to, whether they're in the Baltimore or in the Annapolis area. And I am very, very selective of the community that I support with regard to fertility. And so I'm very, very honored. I'm like fangirling over here because I'm like, oh my gosh, I'm sitting on this with these amazing people. So just to tell you who is here, and then we'll get into the whole what are we talking about kind of thing. We've got Dr. Pamela Woodward from First Step Chiropractic. We've got Dr. Bryant Harris from TruCentered Chiropractic Care in Annapolis. We've got Nadia Williams of Baltimore, sex therapist extraordinaire. And then we have Hyeon-Jin Kwon, TCM, traditional Chinese medicine, acupuncturist, and herbalist. Woo! And the crowd goes wild. Okay, I'm hyper. Can you tell? Yeah, okay. So what I thought we would do is kind of kick it off with Dr. Pam and Dr. Bryant, and they're going to talk a little bit about the chiropractic care, the philosophies in which regards to fertility and people trying to get pregnant from a physical structural perspective with nutrition and the nervous system and all of that jazz in which they do. So take it away, guys.
Yeah, man. Cool. So, Jesse did a really good job of sort of summing it up and kind of getting things started. A lot of people, when they think of chiropractors, they're like, oh yeah, back pain, but fertility is definitely not in like the top 10 things that I think comes to the average person's mind when it comes to chiropractic care. So I think it's really important right off the bat to sort of shift the focus from musculoskeletal pain to neuromusculoskeletal intervention. The neuro part is where I totally geek out. And I know Brian is like right there with me on that. So, kind of in basic terms, when a patient comes into the office, we are looking at a misalignment of the vertebra, which is in the back. But we call that a subluxation in chiropractic. And it alters when there's a bone that's out of alignment. It's going to change the message that is being transmitted by the nerve near that vertebra. So basically what's happening is the information going up to the brain isn't quite as clear as it could be. And then the brain is like, well, I'm kind of hearing this. I'm kind of getting what's going on here. I'm going to do the best I can to respond on the way back out. And what it puts out is not high quality information, basically. So bad information in means bad information back out. It's like basic neurology when it comes to afferent and efferent pathways and the things that a subluxation or misalignment of the vertebra can affect. So this is the thing that we work on with any patient that comes into the office, whether they're coming in with back pain or whether they're coming in saying, hey, I'm having trouble conceiving. I think the beautiful thing about chiropractic is its simplicity, is our job stays the same. We're not curing anything in the office aside from making sure that the bone that's out of place, we find it, we fix it, and then we leave it alone. And we watch and see the awesomeness that the human body is able to do with a clear message, going in and a clear message coming back out. So there are certain misalignments I find that are more common in my patients that come in having difficulty with conception. And those tend to relate to the parasympathetic nervous system. So everybody's probably heard of your fight or flight nervous system, but there's this other nervous system on the opposite side that's job is to sort of counterbalance that fight or flight, and it's the rest and digest nervous system, the feed and breathe nervous system, and that's your parasympathetics. So kind of the easiest way to think about how these things work is that when your fight or flight is on, it's everything that you need to do to survive being attacked by a tiger. So, you're going to run, you're going to, fight for your life. You are not going to stop and eat a taco. You are not going to stop and have a baby if you are running from a tiger. So if we are in a situation where our fight or flight sympathetic nervous system is in charge, then everything else is going to take a backseat, is really what it comes down to. So, what are some things that would amp up that nervous system? I don't know, being in the middle of a global pandemic, like trying and thinking and focusing on something that's stressing you out, that elevates your whole system and that affects your whole nervous system. So when I'm working with my patients, I'm looking to see sort of how I can help stimulate that parasympathetic nervous system and sort of help to shape, and get that part of the spine really doing its job so it can work to sort of balance the scales. Essentially, there's a time and a place for that sympathetic nervous system, but the time and place for the parasympathetic nervous system is when you want to have a baby, for sure. So, that is the big focus, and the whole mindset that we have to be in when you're considering adding chiropractic care to your wellness group that you're working with when you are working to have a baby. So Bryant, is there anything that you want to clarify there for me?
You did a very fast-paced synopsis of what we do. So it was excellent.
It's the New Jersey in me. I can't help it.
You were going a mile a minute, girl. You were going a mile a minute.
Slow down the replay.
You did say you got your adjustment today, Dr. Pam.
I did. I'm firing on all cylinders. I'm good to go. So.
To piggyback off of what Dr. Pam was talking about, so similar to her, I'm a chiropractor, and my focus is first and foremost making sure that the nervous system is clear of any interference by way of a subluxation to allow for your body to function optimally. But what I choose to do on top of that is also dive a little bit more deeply into the nutritional aspects as well with a lot of my preconception patients. And as you may notice, I'm a male, never had a period, never gonna have a period. So it actually is really eye-opening how much I did not know about what women go through, specifically when they spoke to me about things, and I was like, what's a fertile cervical mucus? I'm like, I don't know. Basal body temperature, it's like, I don't know. So like getting to learn all these things was very important with working with this population. And one of the biggest things that we do as chiropractors is trying to get your body to function optimally. But what I've learned is, given the fact that your period is actually a very good indicator of how well or how healthy your body actually is. Now, if you're unhealthy, your period is going to tell you. And what I've noticed and what I grew up watching was girls were getting put on birth control early to try to regulate their period. But their period, one, needs to take time to regulate. And two, that could just be a sign that their body is unhealthy. And by putting yourself on birth control, hormonal birth control, what ends up happening is it just disguises all those underlying issues that one person may have. And they don't know that they may be unhealthy or nutritionally deficient. All right? So I had to figure out what normal was and explain that to my preconception patients, okay? Just like there's normal nervous system flow, there's also normal of what your body wants to do hormonally during your periods. So your periods are supposed to be between 21 and 35 days, ending in ovulation, thus releasing progesterone. Now, most preconception patients, if they've been on birth control, they don't know if they're ovulating. They don't even know what ovulation feels like because you're not ovulating on birth control, right? You have an artificial bleed. So all these things come into place. And once you come off your birth control, that's when your body starts to try to help regulate itself. And then it actually starts to show pictures of what may or may not be working well. And then we have a better understanding of where you may be deficient in. So one of the biggest things that I see in a lot of my patients, on top of whether they're preconception or not, is that they're vitamin D deficient, all right? And when I'm working with preconception patients, I'm not just working with the woman in this group, I'm working with their partner as well, all right? Because it takes two to tango, all right? Too many women I see are suffering this burden by themselves, and their male counterparts need to take the same burden and the same responsibility for their health and well-being, all right? It's longer than that 30 seconds that you're contributing, all right? So vitamin D deficiency, what they found is that vitamin D actually makes your uterine lining more receptive to pregnancy. So there's actual specific receptors for vitamin D in the cells in the ovaries and the uterus. What many people don't know is that vitamin D is actually a hormone, all right? So it's not actually a nutrient, all right? It's a hormone, and it plays a role in other hormones productions. Thus, a deficiency there could contribute to infertility by interrupting the estrogen system and also reducing the production of anti-Mullerian hormones, which is responsible and involved in the growth of the ovarian follicles. So what we also notice is, since endometriosis and polycystic ovarian syndrome can be contributors to infertility, low vitamin D levels have been associated with those as well, all right? So I tell my patients, if you're gonna supplement with vitamin D, you wanna make sure that vitamin D is actually gonna be formulated in oil, because it improves the absorption, because vitamin D is fat soluble. So we wanna make sure that it is in fat, an oil base or something like that, not as a tablet or something, all right? Because your body won't absorb it the way it should be. All right, next. One of the most common disorders that people are getting diagnosed with, specifically women, and it takes a long time for them to get diagnosed with this, is thyroid dysfunction, all right? So what they're noticing is, and I'll come back to the nutrients supporting this, but what's been noticed that women who have had a high number of miscarriages have tested positive for thyroid antibodies. So it is shown that it's been double that of people who have not had constant miscarriages, all right? They don't have these thyroid antibodies. So thyroid conditions and disorders, extremely common with recurrent miscarriages, and also in women who are suffering from unexplained infertility, ovulation disorders, and premature ovarian failure, all right? So that means we need to be able to support the thyroid. But how do you do that, all right? So that's through iodine and selenium. But you know what's really weird? Most of the time, back in the day, iodine used to be added to table salt. It would be iodized salt. Skirt, took it out. So where are people getting their iodine from? No one's eating just packs and packs of seaweed, right? Who's doing that? I mean, you go get sushi, maybe. So it's like, okay, so you have to figure out where you're gonna get this iodine from, because you're not getting it from your foods, all right? Unless you're eating tons and tons of seaweed, which a wakame salad is delicious. I love it. I would eat it all day, all right? On top of that, a good cofactor to iodine is selenium. And selenium is actually found in Brazil nuts and pumpkin seeds, all right? And it's usually just eating one Brazil nut a day can give you the adequate enough of selenium, all right? So that's your daily allowance. But most people don't eat Brazil nuts, all right? Do any of y'all eat Brazil nuts?
I like ate around them in like the planters mix.
Exactly. They're big, they're like, you know, they're tough. They don't taste like much of anything, you know, compared to the cashews and the pecans, you know, and everything else, all right? So I tell my patients, like, listen, we need to figure out ways of implementing iodine and selenium into your system so we can best support your thyroid, because that is playing a role, all right? Next, antioxidants, all right? So whether it's vitamin A, C, E, ALA, all these antioxidants, they have been shown that people who are deficient in them, whether it's vitamin E, suffer from unexplained infertility, all right? So when they supplement with antioxidants as such, it increases the likelihood of them being able to conceive, all right? Next, we got, everybody heard of omega-3s, all right? You know, people know about omega-3s as a result of its decreases in inflammation. But how does that play a role in infertility, all right? So it's been shown that women who have sufficient levels of omega-3 fatty acids are more likely to get pregnant. Now, what most people don't know is we have this imbalance between omega-6 fatty acids and omega-3s. Ideally in the world, it needs to be 1-to-1. 1-to-1 omega-3 to omega-6. Unfortunately, omega-6, which is pro-inflammatory, is astronomical in comparison to our omega-3 consumption. One, people are like, oh, salmon's so expensive, blah, 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 blah. You know, what about mercury? You know, fish has too much mercury in it. Everybody's scared, so they may not be getting enough of it, all right? But what has been found is that the fact that omega-3s can reduce inflammation, it supports your progesterone production. Remember, let's dial it back to what I talked about earlier. At the end of your cycle, of your period, the goal is ovulation and progesterone production. So omega-3 is going to be helping with that progesterone production. And it also increases your uterine blood flow, all right? Additionally, ALA, or alpha lipoic acid, which is also an omega-3 fatty acid, has been shown to improve fertility and improve your eggs maturation. Well, we're gonna cycle it back, turn it back to the gentleman. And for gentlemen, it increases and improves your sperm quality, your total sperm count, the sperm concentration, and their motility levels, all right? So when I'm saying it's important for both men and women to get on these supplementations, because guess what? That sperm is 50% of this egg process. And the sperm is actually responsible for the creation of the umbilical cord and the placenta. So the sperm quality is actually really important. And sadly, they do not test men for any issues with their sperm unless women have suffered 3 miscarriages. So again, the burden falls on the women far too often, and they're suffering, all right? Next, we're gonna talk about insulin resistance, all right? So this is all about things that you're eating. So it's been seen that women who ate more quickly digested carbohydrates, so refined carbohydrates that rapidly raise your blood sugar, are 78% more likely to have ovulatory infertility than women who ate slow digested carbohydrates, all right? So the ones that have been found to be specifically linked, the highest risk of infertility are like cold breakfast cereals, white rice, and potatoes. Whereas brown rice, dark whole wheat breads are linked to lower risk of infertility, all right? Also, they show that high levels of insulin impairs your ovulation by disturbing the delicate balance of hormones within your ovaries. Thus, the net result is that even in normal, healthy women, all right, you've been deemed normal and healthy, elevated insulin may contribute to problems with your ovulation, all right? They also note that high insulin and blood glucose levels can compromise your egg quality, all right? So you may want to start to take a deeper dive into what your actual diet looks like, all right? Is it pro-inflammatory? Is it high on the glycemic index? Is it spiking your insulin, all right? Because you want to try to decrease that because of the reasons that I listed previously. And lastly, hydration, all right? Most people do not drink, listen, I mean, I'm hydrated, but maybe not with water. Kombucha, that was kombucha. All right, so hydration is pivotal, all right? Most people do not drink enough water, but what many people don't understand is that 55 to 65% of you is made of water. So again, staying hydrated is of the utmost importance. as it pertains to men, if they are dehydrated, it lowers, it affects their sperm quality. It can decrease the volume of the sperm, all right? And if women, on the other hand, are dehydrated, it can lead to poor egg health and poor cervical mucus secretion. Remember, we want that good cervical mucus because that's going to help. That's like a sperm escalator. It moves that sperm to where it needs to go, all right? So, recap, the things that I tend to focus on, but not limited to, are the fact we want to look at your vitamin D, we want to look at your thyroid so we can see if we need to implement selenium and iodine, antioxidants, your omega-3s, insulin resistance, which we can find through blood work, similarly with a lot of these things, so looking at your A1C, and then also your water consumption, all right? Were there any questions? I know I just talked for a little bit. And
fertility 601.
There's no question.
I try to make it consumable, easily consumable, digestible.
No, that's good. You're doing a good job. There's no questions yet in the queue, but I will let anybody know if there is. And I think that, people, you brought up a lot of really good points. And I know specifically like with a lot of the people that I work with, endometriosis and PCOS is like one of the two of the most common things that I see. Not that it's everybody, but it's a high amount, especially for the PCOS. And we talk about nutrition often, especially within my Pineapple Connections group. We talk about, well, what is it that you're eating? And everybody is taking, most people's doctors want to just put them on a medication without looking at the finer points of the nutritional components. And I know that like when Hyeon-Jin works with her acupuncture clients, like the nutrition is a piece of that. Sorry, just giving a little thing there. But that's part of it, is really looking at the small details, because they add up without you realizing like, well, I thought I was eating a healthy diet, and then, those numbers are still not where they need to be. And then once people start making, not that it's a fix, like 100% fix, because there's usually other underlying reasons, for the fertility hiccups, but when they can make some of those changes, the AMH levels can change, and that's huge. And so I think that we forget that, the wellness wheel, what we put in addition to just, liquidating, with the hydration, that the nutrition is an essential piece. And, and that goes for both partners. And especially like when, we look at like for same-sex couples that use their partner's eggs that are then transferred, I see like everything under the sun. So it's really, really important that both partners really are taking care of themselves, not just, from the psychological perspective, but the physical and the nutritional side of that too. So I really appreciate you, Dr. Bryant, really honing in on that, because I think sometimes we read things, we see all these blogs, but it doesn't always like click. And then hearing somebody as passionate as yourself, talking about those fine points, it kind of hits home a little bit differently about like, oh, okay, well, maybe I really should think about some of those things a little bit deeper. And, and then seeking a professional that can actually help someone come up with the strategic plan. And I think part of what can be a little overwhelming with working with so many different practitioners is that you feel like you're drowning in all of these things. Like, how am I keeping up with all of this? Like, I already have my fertility, the appointments with the fertility clinic, and I have to have my blood drawn, on these days, and then I have to have this test and all that sort of stuff. But I think that by working with professionals such as us, is that we kind of are the people that take a step back and we're like, okay, so these are the things that you can short-term work on that might be a little bit more realistic versus like, okay, we want you 100% eating like all of this stuff and cold turkey this and cold turkey that and only doing these things. But when we can start off with some of the more tangible things, like our scopes of practices can make this like, it's a lifestyle shift. I don't like to use the word change so much, but it's a shift of perspective of like what we need to prioritize now that will ultimately hopefully help our body balance out and maybe normalize, if that is such a thing for the human body, or equalize a little bit more of a homeostatic presence. Like, I guess if that makes any sense.
I think what I love about all the stuff that Dr. Bryant talked about right now is, you know, in this moment, so much stuff, so many of my patients have all of their treatments put on hold. And that is like, obviously devastating, you know, every day that takes by, it just feels like, oh, you know, like, there's this general sense that I get from a lot of my patients. They feel like they're running out of time and everything is out of their control. And that's so overwhelming. But when you look at some of the nutritional side of things, it's like, okay, you know, everything else is out of my control, but look what I can control right now. I can up my water intake while I'm stuck in my house. You know, I can throw some Brazil nuts into my Instacart. Like, okay, you know, let's, you know, we've been working a lot with some of my patients on sort of reframing the stuff that we can't control right now is out of our control. Let's take this opportunity. Let's like institute some good nutritional habits into our day-to-day life. And then, you know, in this time, you're building up, you know, there's cellular turnover. So you're taking this time and really starting to build up a nice healthy round of egg or sperm, you know, ahead of your next round, you know, wherever you are in the process. So that's it's a really cool, you know, and even if that's like, okay, you know, they already did, you know, they took the egg, you know, we got through that part of treatment, but, you know, now let's start to make a healthy uterine lining, you know, and so it gives just a little bit of control back, you know, in a time when everything just seems like it's off the rails, you know.
I try to make sure that like the information we're giving is also not overwhelming because there are people watching who are going to be like, okay, now I have to get rid of everything in my pantry and I have to do all of this stuff. But to make a full shift, you start somewhere. And because it still takes time for your body to make the necessary changes, nothing happens even within 3 weeks or 6 weeks. Like there's changes happening, but it's, you know, we have to start somewhere. And that's what I think is so valuable about having all of you guys be able to talk about these things is because you guys are pivotal in like, oh, the light bulb goes off. Now I can start to I can see a little bit of that clarity of things that I can do without being too overwhelmed with it. Because I think when we want to, you know, people who want to have a baby, it's like, okay, I've got to like, you know, tighten up the bootstraps and we got to just get going. And then it gets really overwhelming and bogged down. And so I'm going back to like me just being grateful that you guys are all here because it is simple. We just have to make it so that we don't go down like that spiral and then the guilt that goes associated if I don't do like all the things. But I think that if people make an appointment, you know, whether it's in the office, you know, with the chiropractors or virtual appointments with their practitioners now, like you can start the conversations and start getting the wheels moving to be implementing some of those shifts now. So,
and I think, you know, just kind of, again, sort of coming back to the broader sense of all of you practitioners listed here, you know, definitely you can probably tell via the virtual screen here, but like I get super excited anytime one of my patients like accomplishes anything. They're like, I drank an extra glass of water today. And I'm like, yeah. And I used to high five them, but I don't anymore because that's not allowed. But like we get really, I'm going to get really excited about like any victory. And I find that that's something like with people that are on more the holistic side of care, like we are going to cheer your victories with you. We're not necessarily limited to, you know, a 15-minute visit where we, you know, we have to kind of get in and get out. And we have the luxury to really go on the journey with you guys. And I think that is, it's the best part of my job. I love it. So if you ever need, whoever you are out there, even if I'm not your provider, if you just need someone to like celebrate your carrot intake for that day, I'm here for it. Send me an email.
She's your biggest cheerleader. She's your biggest cheerleader.
Every time.
All right, so let's go ahead and take it. So we've talked a little bit about the physical. So now I want to talk a little bit about the mental piece. And so I think, and I kind of dropped it that, you know, I do work with a lot of same-sex couples as well. And I think it's important to realize that there's a lot that goes on in communication, whether, you know, whatever your relationship looks like. There are a lot of things that are associated from a relationship standpoint. And intimacy is one of the things that can really take a hit while people are trying to conceive, whether it's naturally or they've started IVF or IUI. It's really, really hard. And so with that, I brought Nadia Williams on because she is who I refer my clients to, and she is Baltimore based, and she's just amazing. So I'll just turn it over to you.
So, and one thing I thought was interesting when Pam, you were saying about like being that cheerleader, when people come in and say things, I get so excited when my couples come in and tell me that they've been having sex. I'm like, especially the couples who haven't had sex for a while, I get like super excited. I'm like, let's clap and do a cheer. So, yay. So something that, I kind of been writing down some notes just of things that I want to kind of share with the audience. So I think just a place to start is finding the right couples therapist. Right now, pretty much every therapist that I know is doing virtual sessions, of course, for the safety of everyone. So I also feel like there are more therapists that are available right now because there are also quite a few people who want to wait until they can be seen in person. So if this is an area that, if this is an area that some of the audience members want to explore, I always let people know, like, part of it is just doing a Google search. Psychology Today is a great place to find therapists, read through some of the profiles, see who you click with. I always tell people I'm not the right therapist for everyone, and that's okay. If you try me out for a few sessions and it's not working out, let me try to help you find the right person. And most therapists will do the same thing. It's really important that you click with someone. And I will get people who are seeing just me and maybe they're gynecologist or someone that they're working with their infertility. And I say, like, it's great to have a holistic approach. So this is where acupuncture, chiropractic care, pelvic floor therapy, it really is almost like a team mentality, getting that village behind you. Because, it's when there are hiccups around conceiving, it can feel so daunting, especially, and it's for both partners, but especially for the female partner, where for the female partner who's trying to conceive, it's just, it feels like so much pressure and so much stress. And when there is pressure and stress, there's a lot of physical things that are happening in your body, right? A lot of blood vessels are constricting, desire kind of is waning. And sex is supposed to be fun. I think that's the key thing here too, that, when there is that goal for conceiving, sometimes there's so much pressure of like, okay, oh no, I just had my period and now it's, there's that like come down from that, like so sad. But recognizing that some of the times when you are least expecting, like when you are really just in tune with your partner, right? When intimacy is just, there's a connection there. It's, you can hold each other through these processes. When that period happens, it's like, you know what? That's okay. We're going to keep going because we care about each other. So communication is a big thing that I talk about with my couples. And especially right now, it's very interesting because people are stuck in the house together, for long periods of time. Sometimes some people don't have the luxury of space. I don't know if people were noticing that I kept looking this way because my husband was being really loud, and I'm like, you need to shut up because I'm on this Zoom thing. So I think too, it can be difficult sometimes trying to create a space for yourself where self-care is needed, because when you are able to engage in your own self-care, you can bring yourself down to an emotional baseline, which then helps you with better and more effective communication with your partner. And it's not easy to talk about these things. We have grown up in a society that is so sex negative. We have grown up in a society where the messages around sex are somehow you're supposed to just know how to do it. The pieces are supposed to fit, right? Like it's all, any information out there or, old information out there is really geared towards straight couples. And, oh, these are how the puzzle pieces fit. But we are not taught how to communicate. Sometimes, I get clients who are coming in who are experiencing a lot of pain with vaginal penetration, and they've never heard of a pelvic floor therapist. And I feel so sad that this information has not been communicated to them. So there's a lot of compassion and self-compassion that is needed and a lot of empathy between spouses and partners. Sometimes you're not going to always agree, and that's okay, right? I think there's that myth that, this other person is supposed to be my soulmate, is supposed to know everything, is supposed to agree with me on everything. No, you're two individual people. You don't have to agree on everything, and that's okay. Can you have empathy for why your partner is thinking the way they're thinking? That's really what it's about. Do you have an understanding of why they're thinking the way they're thinking? It's okay if you don't agree. So these are some things that I work on with my couples. I work on a lot of figuring out like what is pleasure, because again, going back to sex being fun, if you are not having like pleasurable activities in other areas of your life, and as a couple, why all of a sudden are you going to have a great sex life? I mean, this is, it's when I ask my couples, I'm like, how do you flirt? Oh, and I get the weirdest faces when I ask that question, because people are like, well, what do you mean? Well, what does it mean to you to flirt? And that's the thing, every couple is unique. Every couple's interactions are unique. Are there some themes? Yes. But still, the goofiness that couples can bring into a session, it's so fun to watch that. It's so, we get to, I think for all of us practitioners, we get to be a little bit of we get to be these observers and these witnesses to some really powerful moments in our clients and our patients. And, we hold that space for them that I think is very important. And we are modeling to them how to hold that space as well. So there's a lot that can happen in therapy and sex therapy. And it's going to be unique for every couple and every individual that comes in. I literally could talk for hours, and I've done some trainings where I've talked for hours on so many different themes. It's always lovely too when I get questions from people, because then I have a little bit of direction. But there is, it's, therapy is daunting and can be a lot, but it can also have humor. It is an intimate experience. When my couples come in, it's intimacy for me as well. And, a very famous sex therapist who, if you're any people listening, check out Esther Perel, who has a lot of, wealth of knowledge. There's tons of authors that I adore, but she's also a great one. And she talks about intimacy, into me, see. So intimacy is not always just that physical side of it, right? What are the other things that you are doing as a couple to connect with each other? How do you feel seen? How do you feel heard by your other? And when you are bringing that into conceiving, how does that help maybe relieve some of that pressure? Because that pressure is going to be detrimental. It's going to be detrimental physically, because like I said, the anxiety constricts the blood vessels. It's going to prevent some things, but emotionally, relationally, all those things are also going to be affected. So sometimes it's about slowing down a little bit as well. I think the rush that we sometimes experience, and I noticed too, like when I started, I was rushed, because as I started speaking, part of it is because this is a little anxiety producing as well, right? When I have one person that I'm focusing on, it's a different story. But when I'm trying to share a lot of information with, I don't know how large of a group, and eventually it'll be a large group when people start watching this video, it's a little anxiety producing. So also learning how to slow down. It helps us feel like we are more effective just in general as a human. So any questions or anything else that I can kind of comment on?
No, I think that's great. And it is really, really hard. I mean, with the support group that I run, with Pineapple, the biggest thing is, My partner doesn't get me. My partner doesn't understand. I'm on these hormones and they're making me more emotional and they don't understand, or, you know, they have another loss, like it's a repeat loss. And they're like, you know, they think they're trying to support me, but, you know, this journey is really hard. And until they're physically in my shoes, like they can't really empathize. And it's like, it's constant communication, and it is hard. I mean, it is very hard for the partner. You know, they don't understand what it feels like physically, and they're helpless. Like, partners often want to fix the things that
Yes.
are broken. And that's part of where the communication can be so challenging with couples, is that like, you can't fix this stuff. Like, you can do what you can within your ability, right? Like, that's tangible, like what Dr. Pam was saying, like, this is something within your means of controlling, but you can't necessarily always control the outcomes when it comes to this type of experience. And so I think that it's comical, because it's like, you almost feel like you're watching a clown show, because it's like the constant bickering in the back and forth. And then it's like, no, why can't you fit into the clown car? You know, we can get one more, you know, like all these types of things. And maybe that was a bad analogy, but you get the point. Like, it's very like, you know, Three Stooges effect of like trying to get the empathy, trying to explain. And then it's like this constant seesaw. And I think that people who maybe they thought they had great communication prior to trying to conceive, then they're really testing that relationship and how they use their words, the tonage, and like just interacting on a regular basis. Like, it's all different. And I think that you probably, or well, you not probably, you give people the best way to kind of spice things up a little bit with the way they communicate and the way that their nonverbal cues are, and like all of that, right?
Well, and a lot can be said for just taking space.
Yeah.
Like, I mean, there is something about when you are upset with someone and you are in the same room as them, the energy continues, that negative energy, right? Where you are just, you're seething. So it's very important that when there is conflict to, you know, I kind of try to help teach my couples, like, okay, when you're not in a conflict is a great time to have a conversation of, okay, what's almost like our safe word or our signal that we're going to give each other before we get to a certain point, right? Because when you hit that peak, all bets are off. You're going to argue. Healthy couples argue. I think that's the other myth out there, right? That somehow we are not supposed to be in conflict. We're supposed to be, again, partners in everything, and somehow we're not supposed to be mad at each other sometimes. It's going to happen. Yeah. Hopefully, with better and more effective communication, it doesn't, the anger and the resentment doesn't last as long. And, you know, people can, and part of it too is coming back together after conflict to talk with each other. And if you need to take a day, take a day. Every couple is different, right? Sometimes it's as little as 20 minutes. Sometimes it's as much as a day. If you go to bed angry, it's okay. That's an old saying, don't go to bed angry. Sometimes you need to sleep it off, right? And then you come back together because you're fresh. If you are taking the space properly, you are self-soothing and not sitting there and just thinking of the next thing you want to say. Because as soon as you are rehashing what that conflict was, you're going to still be sitting in those emotions, and it's not going to change. It's going to be hard to get to that place of empathy, of thinking, what can I do for my partner? And also for, you know, some of the couples, Jesse, that you said too, where, you know, you have the one person who's doing all the hormones, who's doing all the treatments, and it's so much pressure on that person. And they feel so sometimes misunderstood and invalidated by the partner who's trying to like fix it, right? I love my partner. I don't want them to feel the way they're feeling. I need to fix it. The simplest thing that I tell the partners is to say, is there something I can do for you right now? And part of that is it allows the partner to say, yes, here's what I need. And hopefully with the right tone and everything, it's going to be, you know, communicated effectively. Or it's like, I don't know. And even if it's an I don't know, the other partner can then say, okay, I'm here when you need me. Or I'm here when you kind of can think of like, what is it I can help you with right now? Because, you know, it's not about fixing. We can't change our partners. We have tons of influence on our partners, and that's a power that we have to be aware of. And what do we do with that power? And then our partners can influence us, and then we can kind of make some decisions around that. Like, how are we going to react to this influence?
I love that. No, that's great. It's perfect. Perfect. Thank you. I really appreciate that. And I think that, you know, oftentimes people who are going through fertility treatment, they don't think that seeking a therapist's support and guidance is a part of that wellness wheel. And I think that it's a very vital piece to it. 100%.
One thing I also just something, you know, because so often we talk about fertility, Brian, like you said, that it's so much focus on the female who's trying to conceive. And this is, I'm going to talk about this in regards to straight male and female couples. Sometimes men are also experiencing erectile dysfunction because of the pressure of trying to conceive. And too often we don't talk about this. You know, there's that side of it too, where men feel the pressure as well of like, I want this to happen and I feel anxious about this happening, or I'm terrified of this happening. I want it, but I'm terrified of becoming a father, of my spouse becoming pregnant. So this is another area where having a therapist can be helpful, just to talk through some of the underlying anxieties and thoughts that may be impacting and impeding men to you know, feel pleasure and to feel full arousal for, you know, for conceiving.
Oh, that's a really good point. I don't think that people think about that often when it comes to doing that. So awesome. Thank you so much. That's all really, really great. So with that, now we're going to go back to the physical, but the physical is also energetically, emotionally, and physically, which is kind of why I wanted to have Hyeon-Jin go last, because it's almost like an encompassing of like everything. I feel like I gotta like start doing a dance or something. Okay, don't worry, I won't. But so Hyeon-Jin Kwon is a traditional Chinese practitioner through acupuncture as well as through Chinese herbs, and her practice focuses a lot on reproductive health. And I know over the years she's seen a lot of my clients who have been on the trying to conceive journey, whether it was naturally or by utilizing IUI and IVF. So, Hyeon-Jin.
No, I almost feel like I don't know which way to go. I have like so many thoughts. But fertility, I think, is the most extraordinary roller coaster that I can ride with patients. I mean, the highs and the lows and everything in between. It's so unique compared to any other population that I treat. But I appreciate when patients come in and they've worked with therapists, chiros, naturopaths, with Jessie. It just makes my work a little bit easier just because they have so much more information. I think going back to Dr. Bryant, there's like so many things that I wanted to hit upon that you had said. And it was just, you know, women's health, the period is the biggest indicator of what is going on. And so your period will be my best friend as we go through our sessions, but not my best friend, it'll be your best friend. When women come in, I meet them where they are in their journey. And sometimes it starts from the very beginning of what do you know about your period? And for some women, they just don't pay attention. You know, I don't know when it comes, or I just listen on an app, but I don't know how many days that I bleed, you know, what is the consistency, what is the clotting? So for some women, they're very surprised how many questions I do ask about that. And it's not just the period, but it's also ovulation. You know, what is going on with all of your bodily fluids? I will ask you so many questions about bodily fluids, whether it's mucus, it is urination, it is how much you drink, like Dr. Bryant said, is very important. You know, does input match output? What are your bowel movements like? I mean, it is going to be a very intimate session. And I think that's really important as you go through this journey. And for us, Chinese medicine is interesting because we break it down week by week. So there's so much fluid-wise that's happening that you might not be in touch with, that's happening week by week. So whether it's your yin, your yang, is it your jing, what is going on? So, you know, your sessions will always include some key point questions that I will ask all the time. And then going back to so many thoughts, also with the men, I always request men come in. I just don't want to see the women. I want to see what's going on with the men. And it has to do with physiology, but what is lifestyle habits? What do you guys like together? What kind of exercises do you do? All that is really important to fertility. It's not just about this, the sperm analysis, which, men will come in and be like, this is it, everything is good. There's nothing on my part to do, which has, there's so much more than just what's going on with your sperm, because how do you have healthy sperm? It's your lifestyles. What do you eat? What do you drink? What do you do? All of that. It is 50% of you, right? So, you just can't like wash your hands of that. And I also want them to be emotionally involved, as Nadia had mentioned. I think, I'm very fortunate because I do work with men and women, and they're more than willing to come in more often than not. So I see the dynamic of what's going on when I have my individual sessions with women, and then I have it with men. And it's very interesting what they say and what they feel and what she feels and what she hears. And so I get these little glimpses, and in some ways, not breaking HIPAA, but trying to figure out how to get them to where they need to be. And does that mean, do they need scientific evidence? Do I need to send you into an RE to get a better idea hormonally what's going on? Do I need to send you to a therapist? Is there past trauma with women, with men, that's creating these energetic and physical blockages when they come to the office? So I kind of look, as Jessie said, the total picture, what's going on a physical level, what's emotional, what can I remove energetically, what can I help physically, say if it's with the chi or the blood, and that's where Chinese herbs come into play. And it's something that you can do every day versus with acupuncture. I'm lucky if you come in once a week. Very few will come in twice a week, which is very nice, but at least with herbs, you're addressing what you need on a daily basis, which I think is really beautiful. And then supplements. And so supplements, we do a lot of education around what vitamin D, what's necessary. Things like ovarian health, I recommend certain supplements for that. But on that side, I appreciate all the testing that women do when they come in. So it is, what are you low in? And thyroid, it's not just, the basic panel thyroid. It's like, I really want you to know and get a detailed, comprehensive test on thyroid. What's going on with AMH? What are all your levels? I think that's all, just the more information we have is the most important. We use all of that. So I look at it from an Eastern viewpoint, but then I also take all the information that Western medicine can give in order to make, a good treatment plan for patients.
That's good. If someone, that's okay. If someone wants to start down this route, how, if they haven't started IVF or IUI yet, when is the optimal time to start working with a practitioner with acupuncture and Chinese herbs?
I mean, the sooner the better. I feel like, before there's any issues, it's best to know what's going on with your body. And that means really getting to know your period. And then it's also, the first thing is come off birth control, especially if you're there for fertility, because we don't know what your body is doing without hormones. And so to get a clear blank slate of what is happening, we need to know what that is in order to know where we're going. So, even before conception or even thinking about it, but that's not always the case. And that's where I say, let's meet you where you are. And some people it's, halfway down the journey. Some people it's, almost towards the end. And so we do what we can. And also, what are you comfortable doing? Sometimes it is overwhelming for some people to be like, these supplements, these herbs, go see a chiro, it's just a lot of things that they feel like doing. It's a full-time job. And so it's a matter of, where do they want to be? Where do they want to go? And sometimes with motherhood, I know I ask that question, a lot of women that come in, what does that look like to you? Does that mean that you want to carry? Do you want, are you okay with egg donor? Is it all or nothing? So really it's getting a picture of where you are now. And that line also changes as time goes on for some people too, right? So for me, I'm just riding along the journey and kind of taking the cues from the patient. So.
And then, so for acupuncture, and maybe I'm asking questions because I already know the answers, but it's great when you're coming up. So acupuncture, okay, so we talked about like starting it as soon as possible, as soon as you may, pretty much whatever, when you know that conception is going to be something that might be on your agenda at some point or another. And then if someone is in fact doing IUI or IVF, you time treatments around that treatment cycle, including like for retrievals and transfers and all of that, right?
Yes, most definitely. So generally I see people a lot of times before they're doing any transfer or any IUIs. But for us, we like to see them before and after, especially for IVF, doing retrievals and transfers. There's actually been research, luckily they're doing it now, but it's increasing the chances of conception. So we talk about that if they're able to do that, time-wise, money-wise, it's quite an investment. So,
So cool. Wow, you guys, I'm like in awe, and I'm like totally fangirling over here. Like we could totally go like a whole another hour, but lucky for you, I have another event like in 7 minutes. So but I am really, really grateful because, the whole wellness approach, I know Dr. Sam couldn't be on tonight, but she and I, when we work with our clients, we, as some of you, we all share like mutual clients within the community. And it's always about looking at the big picture and all the pieces that are essential. And then it's like, okay, where are you going to start? Because maybe like for me as a fertility massage therapist, maybe you take a break from me and you just do chiropractic and acupuncture for now, and pelvic PT. Maybe I'm not as important, but as long as I give you like the self-care tips that you can do at home, these are things that are going to be impacted by doing all these other things, because that's what you have the mental capacity for, or the time schedule for. And it's always ideal if people can do like all the things, but we want to make sure that all of the spokes of that wheel are being touched on in whole body approach. And I think that by people knowing how to utilize these resources can better help them come up with a plan of action of one that they feel empowered by, because that's what it all is. Using our scopes is all about being empowered to take control however you can within your health, and seeking these professionals to make the decisions that you feel comfortable with and confident with. And I think that that's really, really important, because people used to think, now it's changed, but people used to think that wellness was just like, oh, it's just going to go get a spa massage or a pedicure and that kind of thing. But the reality is that we need all of these things. And that's part of the reason why, at NIH, they formed the the Center for Complementary Things that go together with traditional Western care, is that these things all encompass an important vitality to our health. And I think that, the more further along we go, the more research, all of our scopes of practice are going to benefit these types of specialties, these populations of people who are seeking our support. So I love that we have the research to back up all the things that we're doing. Like, woohoo, we are real. Come see us. So without further ado, so I'm just going to go down the line so people know who you guys are. We've got Dr. Pam Woodward from First Step Chiropractic in Mount Washington. We've got Dr. Bryant Harris of TruCentered Chiropractic Care in Annapolis. We've got Nadia Williams, sex therapist, psychotherapist in Baltimore. And we have Hyeon-Jin Kwon of Sustainability Wellness based in Towson. I was like, wait, the Towers, Towson, Ruxton Towers. And then you guys know me, Jessie Bernstein of Moksha, and you can see me for massage at Indigo Physiotherapy. Thank you guys so much. Hang on for 1 second at the panelists, and I'm gonna figure out how I stop this without having to end the whole thing, which, oh wait, haha, I got it. I'm so funny.